I want to listen to her lungs, give her some Banamine, and I want to give her some long-acting antibiotic of some sort. I want to draw some blood and see if it, I just want to make sure it's not MCF. I don't think it is, but that's one of my fears as far as why would she acutely get it? I mean, she could get bacterial pneumonia, but something else is going on. So what I'm going to do is to prepare a dart that we're going to immobilize her. We'll have a mask that we'll put on her just to help her. We're only going to have her down for a few minutes. We're going to draw some blood and try to determine what has caused her illness, measure some parameters that we can use to know what the prognosis may be. We'll take her temperature. I know the calculated drug that we're going to use to immobilize her with. It's going to be thiophenol. I'm going to draw up the reversal drug for that dose. And that's always important to do, to have that prepared and known what it will be before we ever proceed with the loading of the dart. When you're loading a dart, it's very important, if you're using a lethal drug like this one, to handle the drug very carefully. And when you're loading the dart, be aware that it can splash out. You do not want a needle stick accidentally. It's important to use a long enough needle but beyond what the needle length of. And I usually turn the bevel of the needle away in case there's any splash out at all during the loading of this dart. If the dart misses or if there's a bad detonation, for any reason I need access to these drugs, it's always going to be with us. And so we have the dart and the reversal ready to go. Okay. All right. But because I can't make her move and I'm not going to go in there, I am going to deliver it into her hip. Now, I know from experience it should take about 3 or 4 minutes to immobilize her, so we're going to go in there in a vehicle so we maintain safety amongst the herd. This is one of the parts where you need to know the normal behavior. They will approach you where they'll walk right up to you. So once she goes down, because we didn't put it in the most appropriate location, it's being a delayed induction, but now she's down. So the important part now, again, is to approach her and be safe about it. So it's important that we maintain her external so she's breathing. This drug, they grind their teeth in this species. That's a normal behavior. Her oxygen level's okay. Heart rate's good. This is simple pulse oximeter. It'll measure oxygen levels. It detects your heart rate too. We're just going to collect some diagnostic samples. I can't prove it being out here in the field what the cause is, but we're going to give her some medications that we'd anticipate, and I can deliver them by an appropriate amount rather than by a small amount in a dart. Right back. She has a fever. Yeah. Of course, you can take a rectal thermometer, take one too, but she's about 104 degrees. We'll do some of this when we get back to the hospital that we can do, and then the rest of it we'll be sending to a reference laboratory for some specific disease entities that it'll require them to look at. And we can come back and treat her based upon that if need be. Hopefully we'll have an answer. The dart has been confirmed it's out, and that's always important. We'll take our mask off, and then we're going to get a safe distance away from her and watch her as she recovers. She'll stand up many times in the first few seconds. She may even come walking back to us because she's still under the influence of that drug. Not uncommon.